Welcome to my YouTube channel. Today we are discussing about Mycobacterium tuberculosis. As you know, tuberculosis is an ancient disease and the causative organism Mycobacterium tuberculosis has been isolated from ancient Egyptian mummies. This disease is also known as white plague or the captain of all the men dead. This disease is mainly confined to poor nations. Coming to the morphological characters, the name Mycobacteria means fungus-like bacteria. They do not stain readily, but once stained they resist discoloration with dilute mineral acid. Hence, this bacteria is called acid-fast bacilli. Mycobacterium tuberculosis is a straight or slightly curved rod having a size of 3 into 0.3 micrometer in size, and it occurs singly or in pairs. Generally, it is known as gram-positive, but it is not correct because it resists discoloration and the moderating effect of iodine. So the best method for staining is Scheele-Nielsen method or by fluorescent dye such as rhodamine. The bacillus, it contains a semi-permeable membrane around the cell which is made up of mycolic acid, and the integrity of the cell is because of the lipid-rich waxy cell wall. Coming to the cultural characters. The organism is an obligate aerobe. It shows a slow growth and takes 2 to 8 weeks for showing colonies. And the plate should be incubated at 37 degrees Celsius, and the media should contain a pH of 6 to 6.4 to 7. Many solid media and liquid media is used for cultivation of Mycobacterium tuberculosis. Solid media include LJ medium, which is also known as Lowenstein-Jensen media, Tarshis media, Loeffler media, Pawlowski media. Liquid media include Dobos media, Middlebrook, Prosco. Liquid media are not generally employed for routine cultivation, but it is used for sensitivity testing, chemical analysis, and preparation of antigens and vaccine. Coming to the resistance property of this bacteria can be killed at 60 degrees Celsius within 15 to 20 minutes, and it is sensitive to formaldehyde and glutaraldehyde. In sputum, the organism remains viable for 20 to 30 hours. It shows resistance towards chemical disinfectants such as 5% phenol, 15% sulfuric acid, and 3% nitric acid. Many biochemical tests are used for differentiating Mycobacterium tuberculosis and Mycobacterium bovis. The main tests include niacin test, aryl sulfatase test, neural red test, catalase peroxidase test, nitrate reduction test, and amidase test. In niacin test, 10% cyanogen bromide and 4% aniline, which was made in 96% ethanol, is added to a suspension of culture. A canary yellow color indicates a positive reaction. Mycobacterium tuberculosis shows a positive reaction. In aryl sulfatase test, bacilli, it grows in a medium which contains 0.001 molar tripotassium phenolphthalein disulfate. NaOH is added drop by drop to the culture, and a pink color indicates a positive reaction. And Mycobacterium tuberculosis, a negative reaction to this test. Virulent strains of tubercle bacilli, it can able to bind to the neutral red in alkaline buffer solution. Mycobacterium tuberculosis shows positive to this test. Catalase peroxidase test. Mycobacterium tuberculosis show a weakly positive to catalase test, and a peroxidase test will be positive. Nitrate reduction test. Mycobacterium tuberculosis shows a positive test in nitrate reduction. Amidase test. Here we show the or we check the ability to split the amides to differentiate mycobacteria. Mainly 5 amides are used: acetamide, benzamide, carbamide, nicotinamide, and pyrazinamide. Coming to the pathogenesis. The source of infection is open case of pulmonary TB. The mode of infection is inhalation of aerosol bacilli, and this bacilli is released by the actions such as coughing, sneezing, speaking, and in infrequent cases by ingestion of contaminated milk. 3000 infectious nuclei are released from perf cough. The inhaled bacilli was arrested by natural defenses of upper respiratory tract. Bacilli reaching the lungs are ingested by the alveolar macrophages, and from alveolar macrophages the organism it reaches the lungs. So in proper immune system, the organism is ingested by alveolar macrophages. But here the tubercle bacilli it able to survive and multiply in this alveolar macrophages, and it reaches the lungs and it constitutes the disease. The virulence is not fully understood. The tubercle bacilli it does not secrete a toxin, and many factors depend the outcome of infection, and they are age, stress, nutrition, genetic susceptibility, and coexisting illness. One of the characteristic lesions which we see in the tuberculosis is tubercle lesion. It is an avascular granuloma which is composed of a central zone and peripheral zone. Central zone contains giant cells with or without cessation. Peripheral zone it consists lymphocytes and fibroblasts. Again, tuberculous lesion is of two types: exudative and productive. The exudative type is an acute inflammatory reaction with accumulation of edemal fluid polymorphonucleoleucocytes. And in productive type, we can see lymphocytes and mononuclear cells. And productive type is mainly seen when bacilli are virulent, and also there are a number of bacilli. Depending upon the time of infection and time of response, tuberculosis can be classified into primary tuberculosis and secondary tuberculosis. Depending upon the site of infection, tuberculosis can be classified into pulmonary TB and extrapulmonary TB. Coming to primary tuberculosis. Primary tuberculosis is the initial infection by tubercle bacilli in a host. In India, it usually occurs in young children. The bacilli engulfed by alveolar macrophages multiply and give rise to subpleural focus of tuberculous pneumonia. And this is mainly seen at the lower lobe or lower part of upper lobe. The HeLa lymph nodes are also involved in this process. The gone focus together with enlarged HeLa lymph node it constitutes the primary complex, and this occurs about 3 to 8 weeks from the time of infection, and also it is associated with the development of tuberculin hypersensitivity. The secondary tuberculosis, which is also known as post-primary tuberculosis, is mainly due to reactivation of latent infection. And the main sources include the exogenous reinfection and it differs from this primary tuberculosis in many respects. It mainly affects the upper lobes of the lung. The lesions undergoes necrosis and tissue destruction, and also it leads to cavitation. Lymph node involvement is unusual. The necrotic materials break out into the airways, leading to expectoration of bacteria laden sputum, and this acts as a main source of infection. In immunodeficient, the cavity formation is unusual. Coming to the pulmonary TB. Pulmonary TB mainly refers to the infection that causes to lungs, and mainly we can see a wide range of symptoms such as chest pain, breathlessness, etc. Extrapulmonary TB. Here tuberculosis is caused outside of lungs, which includes tuberculosis meningitis, abdominal tuberculosis, skeletal tuberculosis, Pott's disease, and genitourinary tuberculosis. Coming to the lab diagnosis. The main methods for diagnosing are microscopy, culture methods, animal inoculation, nucleic acid technology, immunodiagnosis, and sensitive studies. And we will discuss in another video in detail. Coming to the treatment. Treatment includes the usage of bactericidal drugs such as rifampicin and pyrazinamide, and also isoniazid and streptomycin. And also treatment uses bacteriostatic drugs such as ethambutol. And the main problem in treatment is the generation of multi-drug resistant tuberculosis. So in order to prevent that, a new therapy was done, and that is direct observed therapy under supervision, which is also known as DOTS. And this strategy can prevent deterioration of the resistant problem by ensuring the patient's compliance. And the second line of drugs which used for treatments include quinolones, aminoglycosides, and macrolides. Coming to the prophylactic method. Prophylactic method include adequate nutrition, good personal hygiene, and also health education. Health education include early detection and proper treatment of cases. And this mainly include chemoprophylaxis and immunoprophylaxis. In chemoprophylactic method, we use the main drug isoniazid. Immunoprophylaxis, we use the vaccinations such as BCG. And we will go in detail in a next video. So that's all about today's session. Thank you.